idea of a universal basic income. 77% of the delegates, the Liberal members that were there, said that they are calling on Canada to have a universal basic income to help people get off the poverty line and to break this cycle of poverty. I wonder what's your reaction to that?
Well, I think that's very interesting news. Certainly, basic income has been circulating around policy circles for a number of years now. It certainly has picked up steam as a result of the pandemic. And I think what we've seen in the last 14 months is some real gaps in how we take care of Canadians who have fallen on hard times. And while many people think this is unique to the pandemic, I'll tell you, there are a lot of people who are in crisis well before the pandemic as a result of changes in the nature of the labor market and gaps in how we support people who are unable to support themselves.
Well, Wayne, I'm glad you brought that up, because part of the reason we wanted to speak with you tonight is because you were involved with a universal basic income project in your community. And I wonder if you could succinctly help us understand what exactly was the nature of that project.
Yeah, I was part of a team out of McMaster University. And what we did is we surveyed people who were part of the Ontario pilot here in Hamilton. There were about 1,000 people involved. We surveyed about 250 of them and then spoke with another 40 in detail to really get a sense of exactly what impact did the Ontario pilot have on those participants. And what we found is it had a huge effect. Certainly had a big effect on those people who relied on traditional social support, like on the Ontario Disability Support Program. They reported better mental health, better physical health, better lifestyle choices in terms of less drinking, less smoking, and eating better. But that wasn't the most surprising result, because that's what you would expect if you give people a little bit more money. The more surprising result is those people who were not relying on social support, but those people who were in the margins of the labor market, in insecure employment, precarious employment, in the gig economy, working through temp agencies. They were the ones who reported the biggest gains in health and the biggest gains in the outlook on life. I think what that suggests is Ontario Basic Income is more than just a supplement to the social welfare system. It really is a modern labor market institution for a modern labor market that has changed quite significantly in the last 30 or 40 years.
You've mentioned this issue of change a couple of times, Wayne. I wonder if you can help us understand, because a lot of people are going to be listening and saying, this is an excuse for people to not work hard, and we've been able to have jobs and we've been able to earn a living, so why do you need a support system like this?
Yeah, I think two things I would say to that. First of all, there is not a scrap of evidence that suggests giving people $20,000 a year results in them withdrawing from the labor market. Our study showed that most people who are working before the basic income pilot continued to work after the basic income pilot. Some people went back to school with the expectation of re-entering the labor market at a higher level. And so there's just no evidence, and there's not been a single study of a basic income pilot that shows that people withdraw from the labor market for $20,000 a year. But what it really, I think, does is it provides a floor below which people cannot fall, and therefore people can build employment careers with some assurance, some guarantee that they won't fall into complete poverty as a result. And so it actually makes them better able to participate in the labor market, not less able. And that's a reflection of the fact that compared to 50 years ago, when the majority of people were in fairly permanent jobs, had some decent benefits, lasted quite a long time. Today, a growing part of our labor market are in temporary employment. They're working in the gig economy. They're on short-term contracts. And they may have a job today, but then they may not have a job tomorrow. And what basic income does, it levels out those gaps in employment and makes them more secure, more employable.
We've already heard from the Conservatives on this issue of universal basic income, and they have said, quote, it's a risky and unknown experiment that will leave millions more Canadians behind. Also, you mentioned the issue of a study. So There was a 529-page report that was authored by researchers at the University of British Columbia, Simon Fraser University, and the University of Calgary, and they concluded after a 3-year investigation that a basic income plan for all is not the best way to address poverty and other social problems. They say there's better ways to do so by boosting existing social support programs for vulnerable groups in particular, including individuals with disabilities, boosting ability to get dental care, for example, helping people who are the working poor be able to pay their rent, give them rent subsidies. So they're saying this isn't necessarily the best approach. What do you say?
Yeah, well, if you read between the lines of those 529 pages, you can see some of the assumptions they made that really make it unlikely that the basic income model they're proposing is realistic. They just weren't able to factor in some of the savings one would have if you introduce basic income. I think that's the first thing. The second thing, and nobody is suggesting that giving people $20,000 a year eliminates the need for all the other kinds of supports that people will need. We do need a national dental plan. We do need a national pharma plan. We do need to do something about housing. Again, I mean, $20,000 a year is not going to give you much accommodation in a place like Toronto or even Hamilton now. And so we need a whole suite of policies. What I think the people who support basic income suggest is that what it does is it eliminates the troughs in people's labor experiences. And sometimes when people fall into those troughs, when they lose a job, when they don't have employment for a number of months, they can continue to fall, and it sort of compounds itself, and then they have trouble getting back into the labor market. So, and they're quite right. We've never seen a massive basic income program in a country, but we've done a number of studies, and all of them show very positive effects. The federal government has just put out a report that suggests, look, this is a realistic option. The costs are not completely abnormal as long as the provinces and the federal government coordinate their approach and they make the savings they can when a basic income is introduced.
Wayne, we have discussed policy, we have discussed an academic bit of research, but I wonder if you can help us put a human face to this. If the economy keeps changing the way you're suggesting that it is, and it has for the past 30 years, if we move closer and closer towards gig and temporary economies and jobs, and closer towards automation, what does this mean for the average working individual? What would a universal basic income give them?
Well, it gives them some assurance that in hard times, there's something there to backstop them. I mean, much like what has happened during the pandemic. The CERB, in fact, is a basic income program. And what it did is it guaranteed that people wouldn't lose their houses, would be able to put food on the table, would be able to maintain their mental and physical health so they could continue in the labor market in the future. So I think for a large number of people, this isn't just people who are in poverty right now. It's people who might be in poverty in a month or a year because the job they have right now disappears in a month or a year. So I think this is something that probably could benefit probably the bottom half of the population, but it also would begin reversing a trend that has been really strong in the last 30 or 40 years to change the distribution of income in a way that's increasingly less fair. Those people at the top are claiming a much bigger share of the income. Those people at the bottom are getting much less. And a basic income can be one small measure towards that. But it's not the only small measure. I think we need better labor laws that allow people to organize unions. I think we need these other kinds of social supports that we talked about, dental plans, drug plans, etc., to give Canadians a better standard of living. You know, we're getting richer every month. In our economy, even during the pandemic, the productivity is going up, and yet most people don't feel richer. And I think there's a problem with how our society and how our labor market's organized at the present moment.
Okay, Wayne Lewchuk, an economics professor at McMaster University. Thank you so much for your time, sir.
My pleasure.